Welcome to the third part of pleurisy, and what we'll discuss today is diagnosis of pleurisy. How is pleurisy diagnosed? The first and the foremost sign for diagnosis of pleurisy is presence of sharp characteristic pain which is aggravated by breathing. Although this pain may be confused with the pain present in following two conditions, that is inflammation around the heart, which is known as pericarditis, or maybe pancarditis, and it can also be due to heart attack or myocardial infarction. So a sharp pain present in the chest region, which is known as angina, and one of the reasons for presence of angina can be pleurisy, but although there are also present. So in order to differentiate that pain which was associated with pleurisy with that of inflammation, pericarditis or pancarditis, you need to examine the chest in the area of pain. And how you will examine the chest here, you will do auscultation, that is examination of chest with a ear aid which is known as stethoscope. We hear a friction rub that is generated by rubbing of the two inflamed layers of pleura with each breath. The noise generated by this is termed as pleural friction rip. This is a characteristic sound. It's named friction rip. Two inflamed membrane rubbing against each other, which produces a sound which is termed as pleural friction rip. Whereas, in comparison to the friction of rubbing that is heard by pericarditis, occurs synchronous with heartbeat. It does not vary with the respiration. So in order to differentiate the sound which are produced by pericarditis and that is due to pleurisy, you need to differentiate it by continuously hearing that sound. If that sound varies with each breathing, then it's due to pleurisy. Whereas if the sound is associated with the heart rate or the heartbeat, then you need to relate it to pericarditis. With large amount of pleural fluid accumulation, there can be decreased breath sound, less audible respiratory sound heard through stethoscope, and chest is dull sound when doctor drums on it, that is percussion. That is how do you percuss? That is you keep your hand and you, it's like a knocking action. That is known as percussion. On percussion, a dull sound is heard. That is, you just imagine if you knock on a empty jar, suppose there is a vessel which is empty, you get a different sound, and if it's filled with water and you percuss it, you get a different sound. So why do we get a dull sound here? Because of the presence of fluid in the pleural cavity. You can also get this diagnosis done by an X-ray taken in an upright position and while lying on the side. So what do you find here? While lying in an upright position, you will see that the accumulation of fluid was on the lower side or the where this pleural cavities end. Whereas lying on the side will give you where exactly, as this fluid inside the pleural cavity is free flowing, as the person will lie down and the contact surface or the gravitational surface will show accumulation of fluid in that particular region. So occasionally, what is the amount of fluid? Around 4 to 5 liters of fluid can accumulate in the pleural space. Ultrasound is a very useful method in detecting the presence of pleural fluid. A CT scan can also be of your help. So removal of this fluid with the needle syringe, which is known as aspiration. So aspiration can be done, is essential for diagnosis of the cause of the pleurisy. What exactly is causing the pleurisy? So you can have a variety of cause. The fluid anesthesis is defined as either an exudate, which is high in protein, low in sugar, and high in LDH enzyme, and high white blood cell count, characteristic of inflammatory process, or a transudate which contains normal level of these body chemicals. So if it's due to inflammation, it is known as exudate, and A transudate may also be present, which is normal in the above content, that is protein, sugar, LDH enzyme. What are the causes of exudates? If you are able to differentiate between a transudate and exudate, so if you have an exudative fluid, you are sure that some type of inflammation was there or some type of infection was there, such as in cases of pneumonia, rheumatoid arthritis, lupus erythematosus may also be the cause. And what are the causes of transudative fluid? Are like congestive heart failure, liver and kidney disease, pulmonary embolism can cause transudates on exudates. So this turns out that you might be able to find out treatment of pleurisy if you are very much sure about what the fluid accumulated in pleural cavity is. It's a exudate or a transudate. The fluid can be tested for presence of infectious organism or a cancer cell. And you may also have a small piece of pleura removed in order to diagnose about what exactly is the cancer like, or if there is some other super added infections like tuberculosis in it. Biopsy, as I said, you can have a piece of pleura removed so that you can do biopsy. Biopsy of the pleura may be examined for cancer and tuberculosis. It helps to determine the course of action, that at exactly what stage of cancer we have reached and what type of interventions we can do for the treatment of pleurisy. That's all with pleurisy. This is an important topic because it's a complication to many other main diseases that we have seen. So go through it. Thank you.